Okay, so today's question is a 45-year-old patient complains of fatigue, night sweats, low-grade fever for 1 year. She is anemic. Her spleen is enlarged, massively enlarged spleen. Her CBC shows raised WBC count with 68,000 per milliliter, and she has increased of myelocytes and metamyelocytes in peripheral blood smear. So what can be the probable diagnosis for this vignette? Patient has fatigue, uh, fever, night sweats, and anemia. So these three complaints may indicate of tuberculosis. She is anemic, spleen is enlarged, CBC shows raised WBC count, and yes, she has myelocytes and metamyelocytes on her peripheral blood smear. So with this myelocyte and metamyelocytes, we can uh, estimate that perhaps the patient may have malignancy, because myelocytes and metamyelocytes are found in leukemia, and these are the diagnostic criteria for leukemia patient. So patient has myelocyte and metamyelocyte increased, so patient may probably have leukemia, because in leukemia patient has anemia, spleen can be enlarged in leukemia, and increase in WBC count can be there, as well as the upper symptoms like fever, sweats, and fatigue can be there because of anemia, fatigue, and night sweats because of infections, and low grade fever because of decreased amount of normal WBC count. And leukemia abnormal WBC count is increased, so patient may probably have leukemia. And in leukemia, such type of illness, we have to look at the age of the patient, which is 45-year old. So in this age, uh, chronic type of leukemia happens. So look at what may be the answer of this question. Let us look at, yes, it is leukemia. So diagnosis is CML, chronic myeloid leukemia. Now CML is because that first let us understand what leukemia is. Leukemia is of two types. One is lymphoid leukemia and another is myeloid leukemia. In lymphoid leukemia, there is abnormal proliferation of lymphoid cells happens, and this is of two types. One is acute lymphoid leukemia known as ALL, and another is chronic lymphoid leukemia, that's known as CLL. ALL, acute lymphoid leukemia, most common occurs in young age, and CLL occurs in elders. And the same is with when leukemia of myeloid cells occurs. So this is known as acute myeloid leukemia and chronic myeloid leukemia. In acute myeloid leukemia, it also happens in young age, and in chronic myeloid leukemia, it occurs in elders. So what are the main factors and features of chronic myeloid leukemia? In chronic myeloid leukemia, we will find Philadelphia chromosome and chromosome number 922, and the another we find BCR ABL gene on blood examinations. So this is the leukemia, and the question indicated in leukemia, there is lymphocytosis, increase myelocyte and metamyelocyte and peripheral blood smear. Patient will have anemia, because all three blood lineage are decreased, like decrease in WBC results in infections, decrease in platelets results in fatigue, bruises and bleeding, decrease in RBC results in anemia, fatigue, dizziness, lethargy. So in this way, we can diagnose the patient that this patient has anemia, this patient has chronic myeloid leukemia, CML.